Good morning, everyone. Thank you for joining us today. Good morning to those who are joining us here on the East Coast of the US and around the world. Thank you for joining us from the Middle East as well. Good afternoon to our colleagues there. My name is Tuqan Seirat. I am Deputy Director here at the Rafiq Hariri Center for the Middle East at the Atlantic Council, and I am very pleased to be here with a distinguished panel today where we're looking forward to discussing some really important issues regarding COVID pandemic in the Middle East. I'm honored to be joined by a great panel, and I'm looking forward to the discussion that we'll be having. Our work here at the Hariri Center focuses a lot on the human and economic development challenges facing the Middle East and North Africa. And the COVID-19 pandemic cuts across many of these issues. It's undoubtedly going to impact the region in the short term, yet to be seen how it will do so also in the long term. And while the pandemic doesn't discriminate, so to speak, vulnerable populations will certainly be impacted even more during these times. As we shed light on the challenges today, we also want to discuss opportunities for improvement and progress in the public health sector in the region. I want to take a moment to thank Dr. Adel Abdul Latif and the UNDP's Arab States Bureau for partnering with us on this event, and to my colleague, Ambassador Richard LeBaron, our non-resident senior fellow with the Atlantic Council, who helped bring this discussion to life behind the scenes. Without further ado, I want to turn to the distinguished panel to get the conversation started. I'll briefly introduce each of my guests, but you can find their detailed bios on the event page. At any time during this discussion, our audience is welcome to add their questions to the Q&A box, and we will take as many questions as we can towards the end. I'll begin with Dr. Ali Muqdad to set the scene for us. Thank you for waking up early on the West Coast to be with us this morning. Dr. Ali Muqdad is a professor of health metric sciences at the Institute for Health Metrics and Evaluation and Chief Strategy Officer for Population Health at the University of Washington. As Director of Middle Eastern Initiatives for the Institute, Dr. Muqdad builds IHME's presence in the Middle East through new research projects, dissemination and uptake of IHME's methods and results, and consultations with regional leaders in population health. Prior to joining the Institute, Dr. Muqdad worked at the U.S. Center for Disease Control and Prevention. Thank you for joining us again. Can you give us a lay of the land of the situation that the MENA countries are facing with regards to COVID-19?
Thank you and good morning. COVID-19 came to the region on top of pre-existing conditions. So we have a large vulnerable population due to war and unrest. So we have refugees, and we have low socioeconomic factors in many countries, malnutrition, poor sanitation. And COVID-19 came on top of that. So countries already were struggling with a lot of health issues, and COVID-19 came on top of that. So what we see right now, in many countries in the region, there is a large problem with COVID-19, such as Egypt, for example, Iran, Iraq, and Saudi Arabia, and Yemen. Other countries have done much better, like Jordan and Lebanon so far. Thank you.
Okay, great. Can you tell us a little bit about some of the primary weaknesses in the health system that the virus has exposed? And are there any particular strengths, whether it's regarding how governments have dealt with the virus, that we can shed light on?
So what happened, all governments in the region shut down and asked people to stay at home in March. So that has helped many countries in the region, especially those where COVID-19 hasn't spread. So when they started the lockdown, they didn't have much circulation of the virus, except for, of course, Saudi Arabia, Iraq, Iran, and Egypt, where the virus was already circulating. So the shutdown helped a lot of these countries. Right now, as they open up, that's the problem, is people are letting down their guard, they're not wearing their mask, and then they're staying away from each other. The weaknesses in the region that COVID-19 has shown is a weak public health system, unfortunately. So there is a weak medical systems in many countries. So if you take the Gulf, they have good medical systems, for example, Lebanon, Jordan, but the public health system is not of equal activity in many ways. So they don't have good vital registration systems, so they don't know how many infections they have. The hospitals are not reporting how many cases they are admitting. So there is a weakness in the infrastructure itself, again, and also the fact that the people are vulnerable and that haven't been informed widely about their role in this epidemic. So they're counting on their government and the medical system rather than themselves as well, taking care of not allowing the virus to spread in the region.
I know the Institute has done some analysis of predictions where the region could be in the fall in terms of contracting the disease and deaths. Some governments have been very open, some have been more restrictive of sharing information. Can you tell us a little bit about some of these predictions that you have?
So we have projections right now to November 1st for every country in the region. So Egypt, we are projecting about 50,000 deaths between now and November 1st. Iraq, about 16,000. Iran, about 62,000. Saudi Arabia, about 20,000. And Yemen, about 12,000. So Lebanon and Jordan, much lower than every other country in the region. So these projections are scary in many ways, but what I want people to know is we can prevent that mortality. So we have on our web another scenario. If everybody wears a mask, 95% of the people in the region wear a mask, these mortality numbers will go down. The other thing that we need to be ready in the region, I hate to come and talk, but this is a scientific discussion. We have to be ready for another lockdown. And we have to prepare the public for that scenario and basically telling people to be ready to store 2 weeks of necessities at home. So if we have to lock down, we can do it effectively.
Thank you. Those are some sobering numbers indeed. I'm going to turn to Dr. Lina Abirafeh, who's the Executive Director of the Arab Institute for Women at the Lebanese American University, based between New York and Lebanon. The institute was established in 1973 as the first women's institute in the Arab region and one of the first globally. Prior to joining the Institute, Lina spent over 20 years in development and humanitarian contexts within the United Nations and other international organizations. Her specific expertise is gender-based violence prevention and response. And in 2018, Lina was listed as one of the Gender Equality Top 100, the most influential people in the global policy, only one of 2 Arabs to make the list. Dr. Lina, thank you for joining us today. We know that even before COVID-19 hit the region, women and girls have had disproportionate access to healthcare services, particularly those in conflict and fragile settings and host communities. Can you tell us a little bit about the gender gaps in the health sector and how COVID-19 has impacted these gaps?
Absolutely. First of all, it's right to say that women and girls were more vulnerable even before this crisis, even pre-COVID-19. So anything that's happened since has only amplified those pre-existing vulnerabilities. So things like lack of access to sexual and reproductive health and rights, fundamental, highly contested, not something that should ever be seen as an add-on or an extra service, something that is part of a core life-saving health operation, is already compromised even before. So you can imagine with this pandemic, it is viewed as something that is not a necessity and has completely been sidelined. The other concern is gender-based violence, already a problem in the region and certainly around the world. We know that 1 in 3 women and girls worldwide are affected. So we're talking about things like physical violence, meaning in the home, intimate partner violence, which is actually the most common globally and the most common in the Arab region. We're talking about sexual violence. We're talking about sexual exploitation and abuse. We're talking about child marriage, female genital mutilation. All of these things that existed before that have never been adequately addressed are now magnified. So things like the increase in trafficking and the risk for women and girls because of the economic situation, of amplified needs and vulnerabilities. Traffickers prey on those kinds of insecurities, and so they're much more able to exploit women and girls. Things like sexual exploitation and abuse that we have been seeing, things like sex for food, for rent, for supplies, all of these are affecting women in very profound and dangerous ways because they have to struggle for their own survival and that of their families. So other examples, actually UNFPA statistics recently for the region, well, I think it was globally, actually, I'm sorry, said that there will be an additional 13 million cases of child marriage as a result of this pandemic, and additional 2 million cases of female genital mutilation as a result of this. So we're talking about something that has amplified all of the problems that we've had before that we just brushed under the table, never adequately addressed. I think that the difference here with the pandemic is that because this is a global problem, we can no longer other this kind of situation and say it happens to other women over there and not to us. It's time really to see ourselves in the mirror and start to address these situations more aggressively and appropriately before we have other emergencies like this.
Thank you. Definitely a lot to digest there. You wrote recently in an article about the opportunity that the crisis presents for recognizing and valuing women's work. What policies specifically focusing on women's health and well-being should be prioritized in light of this pandemic?
Well, when we're talking about women's work, what I mean predominantly is unpaid care. So if you look at women who are doing all the unpaid labor, that is the majority. So they perform, according to latest statistics, Arab women perform 5 times as much unpaid care as their male counterparts, which is really dangerous. But the silver lining is that being at home might increase the likelihood that that burden is shared, that women's work is made more visible, that the unpaid care is more valued, is recognized, is seen as another job. But in the formal workforce, we're talking about massive underrepresentation of women. Women are going to be the first fired, they already are, the last rehired. There will be no investments or scant investments in their training and support so they can be economically empowered. So the challenge is, how do you then recognize the value that women contribute? The other thing is, because we're all working from home, we're trapped in our houses, this creates a dynamic, although it is straining for individuals and for families and for employees, what it does is build in a de facto work-life balance. So we're starting to integrate our work with our real lives. We're at home, we're balancing our work. We're probably all working more. I certainly am. But the idea then is that it creates a more family-friendly and woman-friendly work environment when you can address all of the different roles at the same time. Again, and with the hope that those things are shared. Now, this is very challenging in a patriarchal context like the Arab region, but I think making these things more visible and shining a light on what actually happens to women's care, women's work, women in the informal economy as well, where there are great risks and no protections. Understanding these things, talking about these things, hopefully will lead to reform and some advancements.
Certainly, thank you. I'm going to turn to Dr. Adel Abdul Latif, who is the Deputy Director of the United Nations Development Program's Regional Bureau for Arab States. Previously, he served as the Bureau's Senior Strategic Advisor and coordinated UNDP's work across 16 countries in the Arab region. He also oversees the UNDP's flagship Arab Human Development Report. Prior to joining UNDP, Dr. Adel Abdul Latif worked at the Egyptian Ministry of Foreign Affairs, earning the rank of ambassador. Thank you again for partnering with us on this event. When we met last in October in Washington, we had no idea what was coming our way. You were finalizing the 2020 Arab Human Development Report. I don't want to put you on the spot, but I'm sure the pandemic has thrown a wrench in your plans, but given you an opportunity to shed light on some pressing issues regarding public health and incorporating that. Can I ask you about an update on the report and how you plan to incorporate some of the current events in there?
Good morning, everybody, and good afternoon for those who are following us from outside the United States. And thanks to the TOCA and the Atlantic Council for partnering with us on this event. And I'm very delighted to be with Dr. Ali and Dr. Lina. It's a pleasure to be with people who really knows what's happening in the region. And I'm very delighted and informed about what they have said in their interventions. Well, of course, the pandemic, has affected many things, including, of course, our plans to work on the report. But the good thing that the theme itself, it is not affected because the report was focusing on the issue of citizenship and leaving no one behind in the Arab region. And of course, the question of public health here was one of the issues that we were addressing, but not as in depth that because of the pandemic. And what we are doing now is we are adjusting actually our research and looking more in depth about the public health policies in the Arab region, how much the countries are spending on health compared to other items, particularly the issue of, for example, armament. So imagine if Arab countries would be spending less on buying arms and more on public health and education. Of course, we would have been much more, and I say we because I think from the region, we would have been much better prepared, of course, to address this. But that's actually is something, that we have to factor, what we will get out of this pandemic. So if we will go to business as usual, I think many people of the region will be left behind. The issue here is how we will get out, getting the lesson that health for everybody is not a luxury, and it is a must particularly for poor people who are living, in poor neighborhoods, very congested, and they don't have access to water and access to many services. So there is a lesson here that we would like to use this opportunity to come out with a more resilient society and a more inclusive society and also more human society, because as maybe Dr. Ali knows, most of the spending, on health in the region, I'm not saying public health, it's mainly, that's serving few people, You have private hospitals that actually at the level of maybe industrialized countries, but the access to people, for the poor people, of course, is not something that we can say it happens. And also something else, most of the people actually in the region, they spend, on health when they are really obliged to go to a doctor, and it's out of pocket. So this is something, that we have to learn, that public health is, as I said, is not a luxury, it is a must, and it has to reach everybody. During this time, we know also, and Dr. Ali will better place than me, how we are also ignoring many other things when it comes to health, vaccination for kids, particularly in crisis countries, how we are actually losing a lot of opportunities also to improve health for the young children in our region. So these are the issues, that we are trying to get, on in our research, working with, prominent researchers from the region that will be contributing to expanding, the scope, particularly of leaving no one behind, because the pandemic, of course, will already, the whole region is left behind on many things. We have several countries in crisis, and of course, the pandemic, will, as Dr. Lina said, will intensify this process of marginalization and exclusion.
Yeah, I think that's an important point that you raise. It's not necessarily just about the impact of COVID-19 on the actual, virus taking place. But I read a recent UNICEF update that predicted that potentially an additional 51,000 children under the age of 5 might die by the end of 2020 because of the disruption to the essential health and nutrition services, so vaccinations and all of that. Just very, very troubling and sobering numbers that we have to look at. When you look at the region and your assessment right now and all of your access to what UNDP is doing there, what's your biggest concern? What are you most worried about?
Well, as all of us, we were concerned about ourselves as well. It goes back to early March when we started to get the news. Of course, it started first in China earlier, but what we were concerned about actually is the time factor. You get in a crisis, we don't know when it will end, and the other thing is the magnitude. So when you place the Arab countries within the world, so first of all, the industrialized countries, they have the means, to apply all this, processes of stimulus for the economy or the lockdown or the curfew, and they have a very well organized, public administration to administer all this, as well as, they have also the science, to address all this. Well, when you get into the region, it is a region that is very dependent, on the outside world. It doesn't have its own, points of strength when it comes to the economy, when it comes also to the science. the expenditure on research and development and health, comes in it, is very little, very limited, and very concentrated in few countries. So our concern is, if even the world, the industrialized countries will reach, a vaccine or a cure, when this will come to the region. So we were working in a space of time that it's unidentified. So until when we will get out, because if even the countries will get out of the lockdown, like some countries are doing this in Tunisia, Egypt, and Jordan, but it doesn't mean we are coming back to normal. Still, you have a lot of restrictions, and still all the lifeline to the region when it comes to remittances because of the oil prices that are going down, when it comes to tourism, when it comes to foreign direct investment, when it comes even to humanitarian aid and development aid, all this, of course, are affected. In the last few months, there were 3 conferences, pledging conferences about countries from the region: Syria, Sudan, and Yemen. And the expectations, to come with pledges, were very, of course, low when it comes to a country like Yemen. The UN was pledging for 1 year 2.2 billion, and it got only 1.2 billion. So it shows you how, because if you get the G20, which is mainly the biggest economies in the world, all of them are affected. And of course, the economies, and the capacity of countries, of course, to spend more on humanitarian development aid is very much affected. And also the countries of the region that had some lifeline, the oil producing countries in the Gulf, they are very much affected, because of the decline in oil prices, because of the decline in demand, and also the oil prices war that came at the same time. So you find, that all the lifelines are almost cut. So how you will manage, the humanitarian situation in Yemen, in Syria, the Sudan, also how we manage the transition in a country that was very promising, in fact, going to a civilian rule and democratic transition. The same thing in Libya, and the same thing in Syria. And also the situation in Lebanon that is actually going down the drain very fast. The decline in the almost the currency is losing 80 to 90% of its purchasing power, of course, against the dollar. So these are the things, in this situation, which unprecedented in the history of the United Nations, which we are celebrating this year, 75 years of the United Nations. This is the first time, really, that the whole UN development system and the international financial institutions addressing such a challenge and a crisis. Today, for example, the IMF reduced, its expectations for the region. It said in last April that the economies will contract by 3.3. Today is 5.7%. And, as I said, the time factor here is really the thing that concerns us, when you will get an end to this. And even if we get an end, and maybe Dr. Ali can say, even there is a vaccine, how we will administer it, in countries that are already going through war. You have 20 million in Yemen, they need food. 6.5 million in Syria, they need food. 5.9 million, they need food in Sudan. This is a region that depends also on importing food. So if the whole trade and the food supply chain is affected in the world, how this will affect the people in the region, and particularly the poor, and also the impact on their health. So these are, I think, there's a lot of concerns, and a lot of concern also because, as a development organization, and work with humanitarian agencies in the UN, even your staff working in the field, is affected. You don't have the critical mass of people that really can help, the authorities that are there and the NGOs to work. So this is unprecedented, as I said, and the only thing that we hope, is how science will be helping. So here, the big question mark is how science will be helping to find, a solution for this pandemic.
Thank you. A lot to digest and a lot to consider for the region, as we've seen more developed countries and countries with much more advanced health systems are struggling under this pandemic. So we can only imagine how much it's going to impact developing countries and regions. as well. I'm going to turn back to Dr. Ali Muqdad to discuss a little bit about what are some of the features of what steps that countries that you mentioned have successfully, managed some of these, managed the pandemic in a better way. Are there certain features or lessons learned that can be applied to other countries in the region that haven't had as much success? Or are there certain elements in countries like, for example, in the Gulf, where there's a huge migrant labor, population that is primarily being affected due to poor working conditions and living conditions that are making this even harder to address?
Very, very good questions. Countries that did much better are, of course, the countries that locked down early. By the time when they locked down, they didn't have much circulation of the virus. So they had a better advantage when they locked down. But the countries that did much better in the region are countries who really enforced the lockdown and who really made it sure to their public to understand the danger of getting outside. So I'll give you an example. Jordan did a good job by the lockdown. Jordan even did a good job by tracing and preventing a spread of the virus. We know in Erbil there was an incident, a guy who came to a wedding, and then there was a big outbreak. They used the army basically to lock down Erbil and make sure they control the epidemic there. So I'm not saying using the army, but I'm saying taking it seriously and then basically adhere to a lockdown message. So Jordan fared extremely well by doing so. The problem with Lebanon did the same, but the problem in Lebanon is people who are coming back to Lebanon right now, they're infected and they don't adhere to the isolation procedures. What you raised, the issue of foreign workers in the Gulf region and even poor and vulnerable population in many countries in the Arab region, so Jordan, Lebanon, etc. What COVID-19 has taught everybody a lesson that unless you take care of these vulnerable population, which happen to be your essential workers, that they have to go out and then work in order to keep the economy going. And if you don't protect them, they're going to get infected because of their conditions, living conditions, and they're going to spread the virus back to you. So hopefully this is a good lesson as we move forward, that we have to address the social equity in the region, and we have to make sure there are minimum services provided to poor people in terms of medical care and in terms of social support as well, safety network, in order to advance and make sure that our country move forward. So the last point I want to make is we did something here at IHME called the Human Capital Index, where we looked at education and health. We created a combined score. And in education, not only we looked at the years of schooling, we looked at quality of education. We called it learning. So we took every country in the world, we took their quality of education. And of course, investing in education and health combined is the sure recipe for advancement of your economy. And unless the countries in the region understand that for economical development for the long term, we need to invest on health and education. And as Dr. Lena said, education of females, because it's very important. We know for health, a more educated woman is more likely to understand the sign of danger for her and her family, more likely to seek medical care, more likely to adhere to a medical message, more likely to be independent, more likely to delay her marriage because she's studying. So education is very important. Education and health are very important. And I hope COVID-19 taught everybody a lesson in the region to take care of our vulnerable population, education, especially our women education.
Thank you. That's interesting that you mentioned some of those, towns and countries that have taken very strict measures that, where their central government is able to do that easily for other purposes as well, like, cracking down on dissent, but not necessarily willing to do that at this time. But, some countries have advanced a lot more in terms of using technology to address some of these issues. Have you seen anything particularly interesting in terms of tracking or that would be good for us to look into, that would be a place to invest more, international aid, putting this together? Or is it more of just the basic foundations of public health that need to be, that we need to invest more in?
No, it's basic foundation for public health. Technology, unfortunately, for our region, you'll increase disparities within your country because technology, not everybody has access to technology. So that's a big problem. So in Yemen, people are illiterate. How could you give them a technology to use when they cannot read and write? A large part of the population. So technology, unfortunately, a solution that will create a gap, a wider gap. So foundation for public health is the following. I mean, for every country right now, and countries are in a difficult position. So one way you lock down and then you're impacting your economy, and there is a long-term effect of health. Dr. Adel was mentioning it by delaying services, vaccination, prenatal care, and essential screening, breast cancer screening, etc. So that's a problem, and you're impacting also malnutrition. In many countries, we already have a malnutrition and we have a problem already existing. So that's a problem. How could you prioritize opening your country at the same time saving lives? So right now, countries, all what they can do is screening. And screening, again, countries are facing a major problem. Screening costs between $10 to $20 per test, PCR. So if you take a country like Egypt, doing 10,000 tests a day, you're talking about $100,000, $200,000 a day. A country like Egypt cannot afford 6 months of testing 10,000, 20,000, 30,000. So that's a problem. And then between this testing money, where would you spend the money? Would you give it to poor people to secure food for them so they can stay at home? Or would you test? And when you test, do you have the capacity to trace and isolate? It's very difficult in our region, quite honestly. So we are facing different challenges, and the only way we can deal with it is for the government to gain the trust of the public, not shame them, gain their trust, and work with them in order to make sure they have what they need if we ask them to lock down. And we make sure we have a carrot, not a stick approach here. And the trust is very important. In our region, unfortunately, sometimes there is no trust between the government and the public. I hope this change with COVID-19 over.
Thank you. Yeah, that's an important issue that you highlight, because I know the Arab Barometer has done a lot of survey data, released some survey data about people's trust in government, and all of these basic issues that really need to be addressed that impact the public when a public health issue breaks out. I want to turn to Dr. Lina again. 70% of healthcare workers around the world are women, and they represent the majority in the Arab world as well. But women healthcare workers are usually concentrated in lower status, lower paid roles that typically face a lot of gender bias and harassment. Do you think that the pandemic and the role of women are playing to care for victims of the pandemic will change perceptions and roles for female health workers in the Arab world? Is there a silver lining?
I hope so. I think it will take a long time. I think what we need to understand is to recognize the value of women as carers in their formal roles. As you rightly said, 70% of social and healthcare workers worldwide are female. And then women as carers in their domestic roles and in community roles. I think it's high time that we put a value to this type of a role, but also recognize the risks that women face in doing that. And if we are talking, as Dr. Muqdad had just said, about an additional lockdown, I think these women are going to face even greater risks, as well as women who are not necessarily employed in the health sector, but who are in situations, say, of intimate partner violence. What is troubling is that what is sound advice in terms of a public health perspective also puts women at greater risk at home because of the likelihood of intimate partner violence, because of the increases we've been seeing, because of the new cases that will emerge, because those who are already living in situations of violence will have nowhere to go, no safety, no support. So all of these types of things, not just amplify the vulnerabilities that women and girls already face, but put a burden on the health system because there's nowhere for them to go to seek support and services. We already don't have this, even in times of so-called stability, whatever that might mean in the region. So we're in this constant response to crisis kind of mode. It makes it very difficult for women who are carers and women who are in the home. For me, what I find is that there is something fundamentally wrong with the world when, in a time of global crisis, women cannot even be safe in their own homes. So this tension, I don't think we know how to resolve. And the legislation doesn't do us any favors. Society, stigma doesn't do us any favors. Women's inability to report, fear of reporting, lack of space to report, lack of services. Also, all of this combined with the fact that any of the scant resources that we already had for intimate partner violence or for any of these types of things, the resources that we had pre-COVID have been redirected to the COVID response. So again, we're in a situation where we have next to nothing to work with and an increasing situation that puts women and girls at risk. So all of that to say, it's not just women healthcare workers, it's women everywhere in the region that are going to be challenged. Will the silver lining emerge? Again, my answer is it's going to take a long time for it to happen. And I certainly hope that it does. I'd like to be optimistic.
Thank you. Yeah, definitely a lot of issues for us to focus on long term, not just in the short term. Dr. Adil, can you tell me a little bit about how the UNDP has partnered with local ministries and organizations, and what are the things that the UNDP is prioritizing in terms of this pandemic and how to help people in the region?
Well, thank you. This is, of course, a very important question, not only for us as UNDP, but also for the whole UN system, because we work within, several organizations, that, trying to address the pandemic. Of course, at the health front, the WHO, which is doing, its best, to try to provide, guidance, and also pushing for at the science level, for a vaccine, and also other organizations working on humanitarian issues. Our role, has been defined, to within the UN system, and also with the guidance of the UN Secretary General, to work on the assessment, globally in all the countries where UNDP is working. We are covering almost around 160 countries, and also the socioeconomic response. So how we assess the situation, we have done already assessment in several countries from the region. You'll find in Tunisia, Jordan, Lebanon, and we are finalizing for others as well. And also what would be the socioeconomic response in such a fluid situation. And in the socioeconomic response, of course, we focus, mainly on vulnerable groups, and also the countries in crisis, where we have 8 of them, in the region, unfortunately. So this is the situation where we stand. We launched, our first actually assessment last March, and we had a rapid response facility providing support to our country offices in the region in order to help, governments, if they need procurement, health procurement. Of course, this is done in cooperation and coordination with the WHO. And also if governments will need anything, on the crisis management, because some of them, even they needed, some of the poor countries, of course, they needed a lot of support when it comes to IT, how the government, the business continuity plans, in order to continue, the services and access to people, because one of the things is you lose communication with your own citizens. So how we can end the services as well. And also a very important thing that Dr. Lena referred to is how we address the gender aspect, because there were a lot, and not only in the region, the question of domestic violence, and then we help government to address this. And now we are actually finalizing the socioeconomic response, and we're also finalizing a regional, short report, on what are the challenges facing the Arab countries, which will come out maybe in the next week. And also the Secretary General will be releasing his brief, on the Middle East and North Africa during this month. So our help here is to help the countries, first of all, how they can capture, all the elements, because sometimes during this kind of crisis, governments may focus mainly on economic issues, but we are also pushing, how they address the social aspects of it. There is also a security aspect that we cannot ignore, because governments also under pressure, in the region still, you still have violent extremism, and how they address this. And also the issue of, how they will continue with all the lifeline that I said, that they have lost. One of the major things that is coming out, of course, the issue of social protection. this is an issue, of course, that is where the region was not doing well before the COVID-19, and how we will get out of it with a scheme of social protection, addressing, particularly the vulnerable groups, as I said, and particularly people who are working in the informal sector. You will be surprised that between 60 and 70% of people in this region, depending where, particularly in the middle income and poor countries, they work in the informal sector. So they don't have any access. Even the government, if it would like, to provide any social protection, you don't know where are these people, how we can reach them. They are not connected. And although we can say, when we want to talk about the internet and penetration in the region, it's mainly high in the oil producing countries. But when you take the poor and middle income countries, actually it is still very limited. And also with the power cuts. I mean, we even witness this in countries like middle income country like Lebanon, that people, they don't have any access. So you lose your access to the people. One of the emerging things, of course, is how the government will repurpose their budgets and start, working on the issue of tax evasion. And we are actually find the country like Jordan recently working on this issue. And that's where UNDP work, because we work mainly on the issue of governance, and how we can improve, the performance of countries when it comes to governance, tax evasion, addressing the issue of corruption. I mean, Iraq, the Prime Minister of Iraq just, launched, a campaign on addressing corruption in customs. And this actually, the areas where the governments will have to start to find where they can find, locally, nationally, the resources, to continue their plans when the whole world actually is almost in a lockdown. The lockdown is not only at the national level, the world is in a lockdown. So when the world is in a lockdown, all these poor countries, not only in the region, but also in countries in Africa and Southeast Asia, they are affected. So that's where we are actually working closely with governments and also working with NGOs, on the issue of information and disinformation front, because also how people, from where they will get their information, because that affects, their personal behavior and how they will be addressing, the challenges, the health factor in it. So this is in a nutshell, how we work within the whole UN system. And of course, we also getting more and more coordination with the international financial institutions, particularly the World Bank and the IMF. And I think, if I would say something is positive there, that we really work now very closely with these institutions, because the most important thing is how we can pool all our resources and our knowledge, to help developing countries.
Yeah, you beat me to it. I was going to ask you about dissemination of accurate public health information. We know that that's been a problem around the world, but particularly in the Middle East, where you mentioned there's significant populations that are not connected to the internet, not connected. They may have cell phones that they're receiving, inaccurate WhatsApp threads and all of that. Are there specific ways that UNDP is working to address some of that?
Well, this is mainly, we have to do this, of course, with government, but also with NGOs, because they have access to people, And here I would like to emphasize the issue of localization, because governments in the region, they ignored, the issue of localization, local administration, and that's where, in fact, the first line of defense, it's what you are doing at the local level and how people they are communicating. So we're working with several actually NGOs in several countries in how we can, provide this information, and of course in Arabic, and of course also in the dialect of this, use there, because you can write things, that people sometimes they take them, sometimes to decipher what it is exactly. And all these messages, of course, we have to coordinate with the WHO. So how we can translate all these messages, in a very simple language to people, so they can take care of themselves, how, and the WHO, they have done an impressive work when it comes to it, so we are working closely with them, and as well other agencies like UNICEF, when it comes to addressing, the issues of children, and UNFPA when it comes to addressing issues of gender, of course, and UN Women. So we are trying to to see how we can, connect, and of course, during this time we have to empower the government to work on these issues, because they have, of course, access, but also we have to make sure that, that we are not ignoring any minorities, any groups during this period. And I can say proudly, that the issue of domestic violence has been, with the all UN agencies, we have really putting a lot of emphasis on it, because it is an issue, that I think if we get out of the pandemic, and having a clear policy and strategy how to address these issues, I think that will be good. Also, the issue of how we shouldn't, keep reminding people, particularly poor people, about the vaccination of their kids. These are also things that we are doing it with WHO. So in the front of information, because there is a lot of disinformation in the region before pandemic, I cannot say, we are working closely with all the actors, and hopefully, we can manage, to empower more the civil society and NGOs in addressing this issue, because it's not only government issue.
Thank you. Yeah, I think it's an issue that really requires a lot of investment from different parties, but it's good to know that you're working with NGOs in the region that play an important role outside of the governmental institutions. I want to encourage our audience to put in your questions in the question and answer box, and we'll definitely be looking at them in a few minutes. I want to turn again to Dr. Ali Muqdad. You mentioned an emphasis on education. I was reading that the World Health Organization has some statistics about medical personnel in the MENA. Of course, every Arab parent wants their child to be a doctor, but unfortunately, the numbers don't match with the needs. Looking at Morocco, Egypt, and Iraq, looks like they have between 7 to 8 physicians per 10,000 people, which is much lower than the WHO recommendation of about 44 doctors per 10,000 people. How can we even begin to address some of those issues? And I'm glad that you raised the education issue, because sometimes people don't necessarily connect the two.
So very good question. Before I answer, I want to say about you said females are 70% of the workforce. In the Arab region, in our region, unfortunately, that's true. The community health workers tend to be women because they have access to the households, but that's a danger in itself. Let me explain why. Because we're focusing historically on these women to work on a reproductive health with the woman, and we have to stop seeing women in our part of the world as only a reproductive health issue. So we have to increase the services, and then we have to make sure we take care of mental health and other preventive services, rather than only focusing on when you get pregnant, well, this is what you need to do, and let's deliver a safe baby. So that's a problem, and their training is focused on one thing. So it's good in a way that we have more women going around in community work, but we really need to refocus and make sure that we look at the woman as a comprehensive health, not only as a reproductive health. That's one. In the Arab world, yes, in many countries, we don't have enough physicians, enough nurses, enough pharmacists, and that's a big problem. And then many countries in the region, in Yemen, for example, or even in the Gulf, they bring physicians from other countries, which also helps. If you look at Egyptian physician in Saudi Arabia or Egyptian physician in Egypt, so you have a lot of them going to Saudi Arabia. The problem in the Arab world is not only the lack of physicians, it's also how the system is set up. So when you look at the number of physicians, they're available in big cities. Rural areas don't have physicians. So even you have a little, but where they are is also a problem. That's one. Two, the specialties that they do is also very lacking behind the need of our region. We don't have mental health in many countries. I mean, in Lebanon, there are few of them. Even Lebanon has a good psychiatry department at the American University of Beirut, but still not enough to provide services for Lebanese, especially at this time. And the Arab world has invested in hospital high-end services. So you look at a country in Saudi Arabia, you have somebody who has a headache. Instead of going to the local clinic, they go to so-and-so tahassusi, which is like, why do you need to go there? So we haven't emphasized in the Arab world on primary health care, where you have to go to a local clinic where they provide 80% of the preventive services, and then there is a triage to go to the higher level. That we haven't invested in the Arab world. We haven't trained people to do so. Family medicine is not something attractive in the Arab world. They want to be a surgeon, they want to be so and so. So again, there are a lot of issues here that the countries need, and it's more expensive. The way they are dealing it with now, it costs them more money. If you have a primary health care that's effective and people trust to go to that clinic, and then they believe in a referral system, it saves you a lot of money on the long run, because you could do prevention and treatment as well. Thank you.
I have a question here where someone says, could you repeat and give some more details about your projections for death tolls across the major Middle East nations?
So all our projections are available on our web, healthdata.org. And for Egypt, 50,000 by November 1st, Iraq is 16,000, Iran 62, Saudi Arabia about 20,000, and Yemen about 12,000.
Oh. And then we have another question. Can Arab countries achieve herd immunity? We're hearing more about this right now in the West. Is it going to be different in the Arab world?
Let me tell you, you touched on false information of science. There was somebody in Jordan who said early on that we in the Arab world are immune to COVID-19, which is unfortunately nonsense, set us back a long time, especially before Ramadan. Like, you go out, do whatever you want to do, you're immune. So herd immunity is a term that we use with vaccination. When you reach a vaccine level of 90% for many vaccines, measles, then it means you have a herd immunity, because 90% of the people in your area are not susceptible for the disease anymore. So they can't get measles. So that's how herd immunity comes. Herd immunity to be happening right now in the Arab world. Let's take a country like Lebanon. To reach at 90% immunity of the Lebanese, let me give you an example. New York City has a 21% herd immunity right now. So antibodies in New York City is 21%, 25,000 deaths out of 8 million. So Lebanon is less than 8 million, let's say 5 million. That means in Lebanon, to get to 20%, we need at least about 15,000 deaths. To reach at 90%, we need at least 200,000 deaths in Lebanon. Is Lebanon willing to accept that? So herd immunity means failure. And let me explain why from a disparity issue is a big problem. Rich people are going to stay at home and not going to get infected. Poor people are going to be infected and they die. By the time we find a vaccine, poor people have died. They may not need a vaccine because they're immune. Rich people will get the vaccine. So discrimination across the spectrum. Herd immunity is a failure, and we shouldn't go in that route. We should work on lockdowns if we have to. We should educate our public, wearing a mask, keeping a safe distance, washing your hands, disinfecting the objects that are commonly used. Thank you.
Thanks for clarifying that. I think there's a lot of misunderstanding around that issue. Dr. Adel, question from the audience. Isn't it true that within the Middle East as a whole, there exists enough wealth to permanently fix the institutional public health challenges that exists? What holds them back?
Well, I think any country, even poor countries, they can do much better on health. It's a matter of prioritization. It's not a matter only of money. You will find, some middle-income countries, in Latin America, that they are doing much better. They have also health coverage, the universal health coverage much better than many Arab countries, even much better than the oil-producing rich countries. So it is a matter how you are actually managing your public health system, not only the question of resources. So I think the issue of health in the Arab region has never been a priority. It has been of course we can say that there was progress that happened, particularly when it comes to vaccines and reducing mortality in the region, and the life expectancy has increased in the region in the last 30-40 years. So people, they use the life expectancy moves from maybe around 50 years, it depends where, and then it moves now close to 70, 77, it depends, on the countries. So there is a kind of progress, but about what quality of health people have, that's another thing, that still people, of course, they don't die, from contagious diseases, and Dr. Ali, of course, much better place to say. But then, you have other challenges, And now, when we had, since the last, particularly during this century, the 21st century, the crisis and wars in the region, of course, the situation, has been affected, and you'll find, in countries like Syria now, the life expectancy dropped, Yemen as well. So the issue that we have to learn from here, even a poor country, can do better than what they are doing now. It's not only about money. It's also about, how there is the issue of nutrition, there are issue of education, is how the behavior of the people, you can inform them, and access to water, may improve a lot of things, that improve the health for people. So how you can prioritize health as, an important aspect in sustainable development, human development. This is not the aspect, and particularly the countries when they start focusing on how to join globalization, they were focusing mainly on the physical things, not about, what are the services and the human side of development. This has been ignored for some time, and I think it's about time to reach the conclusion that healthy poor people also is an important thing. Is not only about, how much the country is making money or not, and how many tourists you are receiving. These are, of course, are good things, or how much foreign direct investment you are receiving. It's also how the poor are managing their life, and how they are enjoying their life. It's a different concept, that I think in the region we didn't have, and I hope out of this crisis we can adopt, a more human, sustainable development.
Definitely, we hope so. Dr. Ali, I think you had a comment on this. Please chime in.
Yeah, why countries in the region don't spend on public health? And that's a very good question. There are two aspects to it, one from the government side, one from the public. Let me talk about both, and I'm being very candid here. From the government side, I work a lot with ministers of health in the region in many countries, without naming them. By the time I know a minister and talk to him or her, they have been changed. So there is a lot of changes, one. And then you have a minister of health who comes in and then put a plan for 10, 20 years in order to improve public health and build the infrastructure. Then you have another minister who come after him or her, and they want to show they have done something, not work on what somebody before them has done. And the best way to show I've done something as a minister in our region is to open a hospital, go cut a ribbon. So that's a problem from the policy, is the government doesn't have a long-term plan that every minister will come and will focus on and keep it going. That's a problem, because it's about me, what did I do? From a public health, and again, being candid here, we haven't created a health education and health promotion culture in our public. So they don't request a public health system. They want a big hospital for cancer. They want an open heart surgery, and that's what they're asking for. Although to their advantage is to have a primary health care clinic in their neighborhood that takes care of them with one physician or a nurse. So we have a long way to go in the Arab world, and the way we are doing it right now is totally wrong, because we cannot afford it. That's the problem that we don't understand in the Arab world. In the United States, we spend over $3 trillion on healthcare, almost half of what the world is spent on healthcare. We don't have a good public health infrastructure. We're bankrupt because of that. And what do we get in return of the $3 billion that we spend? Yeah, we have more money in the US. We should spend more money on health. That's okay. But are we getting the return on investment? We're not. So our model is not a good model. The Arab countries should also adopt a different model, investing in prevention and health promotion, health education, and building an infrastructure of public health that's equivalent for the medical system. So the end point here is, if you come as a minister in the Arab world, there is an immediate need treating the patients who are sick. And there is an important need in your country, which is setting a public health course in your country. The immediate should not be at the expense of the important. You have to invest equally on both of them. So thank you.
Thank you. Yeah, very, very important points that you highlight, and valid critiques.
If I may come here, Toka.
Yeah.
No, I think, what Dr. Ali is saying is really true. There is no strategic, plan, on the health side, particularly when you have young people. These are countries, that they have young people, and how you can help them, manage their life, in a better way than their parents or their, grandparents. Um, Investing in health is not a cost; it is an investment. The problem that we look at it as a cost.
Mhm.
And as governments, invest in the building big armies, they have to invest, and I'm really getting in maybe into a very sensitive territory here. But how much, it costs, to buy an aeroplane or a tank, I mean, the cost of these items, can really address, and cover the cost of a lot of poor people, they just want to have access to clean water, that can really improve the quality of life. How you can inform them even about, hygiene, nutrition. Even in rich Arab countries, you have a huge problem of obesity. That's, you need public campaigns, and these people who are in poor condition, once they get, tested positive, of course their chance, to get out of it will be very limited, because of the poor condition. That's, that what we expect from the government, is invest in the human capital, health education, and invest also in informing people, building awareness, and also, how you can calibrate, and repurpose your budgets. I mean, the issue of security, of course, is very important for all the citizens. But the security is not only by having this physical, big armies. It's also about how people feel safe at home, how people safe, in how they have good health, and these people also, if I can say, they will be better soldiers even when you need them.
Lena, please.
I'd like to add to that. Yes, thank you. I think there's a real regional lesson, and in fact, a global lesson that we stand to learn as a result of this. It is to change the way that we measure what is progress, what is prosperity. Dr. Abdulatif, you talked about a possible silver lining with countries emerging with an intimate partner violence strategy or commitment, and the UN has been very strong on this, which is wonderful. Dr. Muqdad talked about comprehensive women's healthcare. You're right, women are not just childbearers. Thank you. I echo those sentiments very strongly. What research has shown us over and over is that the extent of success, of sustainable development, of peace, of progress, of prosperity in a country isn't actually measured by the economy, as you've said, isn't measured by the type of government. It is measured very firmly in how the country treats its women. So this is time to really view our response, our support through the lens of women. If women are the barometer, then we stand a chance to have much better and stronger societies. So there's an end game. There's a long-term view, and you're absolutely right. It is through women on the front lines. Women are responding in communities, in their homes. And again, if we cannot even address the fundamental issue of women's safety, we have failed in the entire response. Because if women are not safe, then actually nobody is safe. So I'm happy that we all agree. Thank you.
Thanks, Lena. We have another question now about medical diplomacy. So Chinese scientific delegations to Iraq, as one example, are tensions between Washington and Beijing a potential impediment to broader multilateral assistance? Without delving into too much specific political tensions, how are multilateral agencies such as the UNDP grappling with this problem?
Well, that deserves maybe the Secretary General to address it, not myself. No, of course, there is an issue here of tension, and I think, many countries of the region, they turn to, of course, to China because it was the first country addressing this, and also a country that has been producing, a lot of equipments, that are needed. I think China was much more open, also to provide this early on, particularly when they got, the virus under control, and the strict measures, they have been very much, applied in the region, looking at what happened not only in China but many countries in Asia, as well as how you need the PPE, the personal protection equipments and ventilators. So there was a lot actually of procurement happening not from the UN system, but also from many governments, looking to China. I didn't see, in fact, how much, other countries are addressing, but now we find a lot of countries from Europe, providing support to the South Mediterranean, in North Africa, and also in the Middle East. I can say that, at this time you have to look at the issue of solidarity, not the issue of competition, because it's mainly about the health of the people, and I don't think the health of the people should be taken, with the confrontation between the big powers. And this confrontation actually is happening not only because of the pandemic, because there is the world is changing, and some countries are emerging, as bigger economies, and I think if any leader in the region will or any government will try to find the equipment based also on the cost. So, but I can say that we can see a lot of balance now when it comes to the services and the support provided. Anyway, the United States is a major, supporter and donor for many countries of the region, and actually we have to recognize, even before the pandemic, the United States, and the role of USAID in focusing on the issue of health and public health, we cannot really ignore that. And also, reproductive health in the region, the USAID was pioneering on this. So I'm not saying that, that the pandemic is only adding, another layer about how maybe some messages before some traditional donors from Europe and the United States were focusing and trying to help governments focus on. So I can say that there is a balance here. The issue of procurement, of course, is important, but prior to that, a lot of information, training, and you'll find many doctors from the region, medical doctors, they have been actually receiving grants and studying in the United States and Europe. That's something, the only issue that I would like to address here, which is not in your question, is the issue of brain drain. And because you have a lot of medical doctors actually from the region has been actually going to Europe and the United States, and this is an issue that Dr. Ali addressed, of course, but that's also how you make incentives, to keep this valuable. I don't think, that you can coerce people to stay in their own countries if they can find, opportunities outside. But these are valuable, and particular researchers in the medical arena, they are very important for the countries, and you'll find a country like Algeria, they invested a lot in public in their medical institutions, and many of them, thousands of them, actually, they're working in Europe and in France. So, I mean, in that case, you will find that these countries actually are subsidizing, richer countries. And Dr. Ali said also about, medical doctors from the Middle East working in some countries in the Gulf. So this maybe will bring to the attention also the importance of education, higher education, and also nursing. I mean, it's not only about doctors. So international solidarity here is important, and the Secretary General was very clear of the United Nations that it shouldn't be taken, that international cooperation is important. It shouldn't be taken within any, confrontation between the global powers.
Yeah, definitely. Dr. Ali, I'll let you chime in, but I also want to pose another question from the audience. You spoke about lack of good models for public health systems in the MENA region, and you shared some of the challenges that, at least we're facing here in the US. Where can people in the region or governments in the region look to for better models? Are there countries that are doing particularly good at public health?
Very good question. So I want to touch on one thing that Dr. Lena mentioned. So I work a lot in the Arab region, and I see a family member who don't want their wives or daughter to be seen by a male physician. At the same time, that same family doesn't want their daughters to go to school. So go figure. I mean, how could you solve the problems if you don't change that mentality? So that's very important. This is a major problem we face in our region. And unless we change and we start focusing on education of our females, because they are the one who will provide the best medical care for females in the region, it's very important. So what is the best model for public health? So we have good examples in different countries. And Some European countries have a better. Singapore has a good system. South Korea has a good public health system. That's why they were able to avoid a lot of these problems. In our region, the problem is we don't have vital registration. So we don't know in many countries what people are dying from. We don't have national surveys in our region like what we have in the US or in Europe to know how many people have diabetes in a country. We really don't know that. And we don't have this infrastructure of a cadre of epidemiologists that have a high position in the Ministry of Health, that have been trained to do early disease detection, outbreak detections, response. We don't have that. We don't have a syndromic surveillance system in our region. So we don't know what the data coming to us from hospital right now. Like if you look at Egypt, testing of COVID-19, you don't know who has been tested. Are you testing people who came to the clinic? Are you testing a random person? Is it people who have been contact traced and then you isolated them after you found them positive? So a lot of information is missing. And basically we're driving blind, honestly. And then unless you can measure something, you cannot fix it. You have to measure it to be able to put a metric for it and a solution and evaluate what you are doing. In Lebanon, for example, advanced medical system, we don't know what people are dying from. We don't have a vital registration system. So the countries in the region shouldn't pick one model and use it. That would be a failure. Pick what's good in every country and every model, and then take it and use it. There is a program in the region that has been very helpful that has helped Jordan a lot with this outbreak. It's called the Field Epi Training Program, which is based on the CDC EIS officers program here. And these are people who are physicians who have been trained to do outbreak investigation, studies, surveillance, and they're sent back to work in their own region. So they come from Erbil to Amman, they train, they go back to Erbil, and so on. So programs like this, where you start slowly, and then, of course, the last thing that's very important is schools of public health in the region. American University of Beirut has a good one. But also we need more school of public health where we can graduate epidemiologists, biostatisticians, and so on.
Dr. Ali, I have to say that the fact that you mentioned Erbil twice in this panel is something like a full circle, because that's where my family's from. So
I had no idea.
I'm glad that you mentioned some good examples there. But there are two questions about the challenges of COVID in refugee and IDP locations. How can countries like Yemen, Syria, or Libya, plagued by civil war, ever come out of a pandemic like this, even if a vaccine is found? I know we mentioned some of that, how it will be administered in terms of actually handing the vaccine out, or, how can they get PPE in Syria if the commentator says US bans exports of N95 masks? So feel free, anyone in the panel, to chime in. Oh.
Problem in Yemen. I mean, I know Yemen. My wife is from Yemen, and she's also a doctor that works in Yemen in a lot of health programs. So the situation in Yemen is very difficult for several reasons. One is they don't have the capacity to do testing right now, even to detect how many cases they have, and a lot of testing equipment and reagents are being sent right now, but not enough to do any early detection. That's one. Two, due to the war, there are so many in the blockade. There's a malnutrition, cholera outbreaks, as you well know, and now we're coming into another set of outbreaks. So Yemen's situation is very complex. Even if there is a vaccine to be distributed to Yemen, it will be too late by then because of the COVID-19. Plus, the government in Yemen is not doing a good job. One of them is in the north not acknowledging that there is even a COVID-19 problem. And the one in the south is also overwhelmed and not being able to do anything, unfortunately. So you add on top of a war and refugees through COVID-19, which is devastating for a country like Yemen, and then with the blockade, and you cannot import certain things, or you're not freely allowed to bring stuff, people are going to suffer, and a lot of poor people are going to die. So over.
Yeah, if I may come in, just to give you the picture, about the vulnerable groups in the region. You have 9 million refugees in the region. Many of them in the Middle East, of course, around in Lebanon, in in Jordan, and also in the borders with Turkey. You have around 15 million internally displaced people, and you have around 24 million foreign labor, mainly in the Gulf countries, and many of them, most of them are unskilled labor. So you have a huge group of people that, they are outside, what the government, they say, consider to be citizens, even the internally displaced, you don't have, good access to them, because the countries are in war, where the internally displaced. And in addition to that, of course, you have the huge informal sector. So imagine the number of people that actually are considered to be what you can say left behind. And of course, the intensity is in the countries in crisis, because you have also lack of authority. In the case of Yemen, as Dr. Ali said, it is a divided country. How many, armies are there, and who is controlling what? And even the only port, that is you get food through it, Hodayeda, is contested between the two groups, and in a very much bad shape, and how much it can, feed, the whole population, were mainly concentrated in the north. The same thing, in the case of Syria, humanitarian aid has been, a matter of discussion in the Security Council for weeks, in order to whether we have one point of access or 2 points of access, and at the end, it is only 1 point of access, in the northwest of Syria. So it shows you how much, also the international politics, is affecting, how we can reach these people. That's a matter, of course, of concern. The figures also, if you look at what WHO is producing about the number of cases in the region by the WHO, which is covering the Eastern Mediterranean, most of the Arab countries, you'll find, if you look at Syria and Yemen, you will find very few cases, but I'm not sure really, and that these are the exact number, as Dr. Ali said, because you don't have testing, but definitely if you have cases, and uncontrolled, this by time, the number, of course, will increase. And by time, it will be very difficult to get it under control. The problem in addressing COVID-19, from my point of view, is that we focus more on the narrative coming from industrialized countries and rich countries. We have the first wave, and we think the first wave will be all over the world. But in this region, the first wave is happening, right now. So, everybody was focusing what's happening in the United States and in Europe. But in fact, in these countries, it is a matter of time. By the end of the year, and Dr. Ali is saying, you will have a much worse situation than now. And the problem is you cannot control. In countries in crisis, who is in charge? That's the problem that we are facing, So even as Dr. Ali said, even if there's a vaccine, when it will reach this country. So we are going through a very difficult time, and I hope that from humanitarian and development point of view, that the global powers will have a look at that, because you cannot ignore some countries and just if you get it under control in our country and you get the business done. The business will be done when you are actually addressing it in all countries in the region, in the world.
Definitely, yeah. There's you've given us a lot to think about and ponder, and I hope that our audience that's watching now and will be watching the replay of this recording also benefits and informs some of the policies that people are working on. I'll conclude with this question to the whole panel. The questioner said key decision makers globally did have an idea as to how bad the pandemic would look like, and yet we failed to even take the simplest of precautions ahead of time. While we are paying attention now, what are the top 3 actionable lessons that should be taken from this pandemic so we are prepared for the next one? And I'll add, so that we are working towards improving a public health sector in the Middle East. And I'll start with Dr. Abirafeh.
Thank you. Viewing this from the lens of women, obviously, I would say that we need to ensure that women are represented at all levels of leadership and decision making in all conversations from the home to the community to the state and at the regional and global levels. Because if they don't have a voice, if they don't have space, then we are missing a massive segment of the population and our response will always be flawed and we will never get it right. They are our best chance for prevention, for response, for risk mitigation. And so that would be my first recommendation. And my second is to pay special attention to the vulnerable groups who are left behind. So when we talk about women and girls, adolescent girls, refugee and displaced women and girls, female migrant domestic workers. There are massive segments of the population, and there are many more, LGBT populations. We need to pay special attention to all of those that we tend to be blinded by, we don't even see, because again, if we're not including all of the populations that are represented in the region, our response will always be incomplete.
And we know that we've seen the actual numbers of countries where women are in leadership positions are tackling this much more effectively. Dr. Ali Muqtad.
So, I mean, we need to remember with COVID-19, it's preventable. I mean, we can take precautions not to allow it to spread. I'll give you an example. I am in the medical school at the University of Washington here. We have several hospitals. One of them is Harborview, one of the largest hospitals here, a big referral hospital for a lot of states around us. It's safer for me to be in the hospital than being in Seattle in terms of getting COVID-19. I mean, so there are measures that we can put in place to protect ourselves. So what we need to do, what this has taught us, this lesson, is one, we're so interconnected as a globe. The blaming game, you did wrong with it, that's not acceptable. A problem in China will affect everybody in the world. A problem among the vulnerable population in Saudi Arabia will affect Saudi. So take care of your vulnerable population. That's the second one. The third one, be realistic. Level with your public. Tell them what you're dealing with instead of hiding numbers and not telling them what's happening. Nobody wants to get sick. Everybody cares about their own country. They want to protect their country. They want to protect their economy. Level with your public. Tell them what you're dealing with. Tell them what they need to do. They will do it.
Thank you. Well, Dr. Adil, any final recommendations that countries should be considering, whether it's to tackle the next pandemic or just to address the flaws in the public health system?
Well, I mean, what we learned from this crisis is business as usual. Actually, it came to an end. It's not that that the government actually want to change. Change happened coercedly. It's people they have to adjust to a new situation. A new situation requires a paradigm shift in the government thinking. It's also public health is an issue, but I cannot say that this is isolated from the whole way the governance system in Arab countries. I'm not getting only on the political issue, but also preparedness, how you address, the concerns of your citizens, how also you prepare the budgets in these countries, because most of the people do not know how the government allocate resources, how you prioritize, the issues of concern for the people. So this paradigm shift actually is very much needed, and they have to do it because they don't have any other solution, because you don't have any resources coming from outside anymore. So you are doing, unfortunately, many international organizations, thinkers, people from academia, they were talking about that for decades, but the pandemic, and the coronavirus is putting, all this governance system in test, and they failed, I'm not talking only about the countries in the region. So how you do this paradigm shift is a matter, not only government, they have to think about it, but citizens also, they have to think about it. The other thing, that I would like to address, is the issue of multilateralism. It is a must, international solidarity is not because I work for the United Nations, but people, as Dr. Ali said, something happened in a country, in a remote area in the world will affect everybody. So international solidarity is something very much needed, because at the end of the day, we are all humans, there is no distinction between race, religion, or any, everybody is actually subject to be affected. And the other thing, is the issue of crisis and wars. I think, it's about time, that the big powers think about how much, it's not a matter really about fighting here among themselves, about countries, silencing the gun, as the Secretary said, is a must. You have people, suffering in many countries in crisis, and I'm not saying it easy solutions, but I think solutions sometimes, could be reached easily, if governments will, be more human in their decisions. And I think this is very much needed. If you look at the sufferings in Yemen or in Syria, I mean, do we really need to go through this? Isn't it another way of doing things? At the end of the day, humanity has a lot of wisdom and knowledge, to end all these things. Why you leave people, living in hunger or under, all this kind of pressure? It doesn't achieve the goals of anybody. But at the end of the day, that's at the heart, of what will be the future of our world.
Can I end up on a positive note for the region?
Please.
Everybody in the region, wear your mask, whether it is a medical mask, you make it at home yourself, or something fancy for your team. Even me, Ali Mokdad, this is a husky dog of the university. Wear your mask when you go out. Stay away from each other. We can control this pandemic. Thank you, everybody.
Thank you so much to you, Dr. Ali, and everybody, this distinguished panel. I appreciate your time. Like Dr. Adil said, this is something that is manageable potentially, and there's a lot we can do to learn from one another and support one another. I want to encourage everyone who is just tuning in to catch the whole replay, which will be posted on our website. I linked to it, and follow us on Twitter at AC Mideast, where we'll be sharing some clips of this discussion, and we'll look forward to reports and analysis from all of our panelists, especially from Dr. Adil's team for the forthcoming Arab Human Development Report. Thank you, everybody. Have a good day and good afternoon.
Thank you.